County Public Health, and I've been in my role for almost a decade, and I do not take it lightly. I am so grateful that I get to live and serve in this amazing county. Hopefully, you know me, hopefully you know some of my staff members. At any given time, Chaffee County Public Health has about 20 to 25 staff members. We serve all over the county, so it's not uncommon for us to start the day out here and then end in Salida or Poncha or vice versa. And what you may not know, I think most people think public health and they think immunizations, communicable disease prevention and protection and response. But a role that public health can play in our local communities is this role of chief health strategist. It's the role that I love best about my job, because what it means is that I get to talk to so many people in our community to explore, brainstorm how we can be thought partners on addressing some of our county's toughest health issues. We do it in a coordinated, collaborative way. We really believe strongly in communicating throughout our county, with our healthcare community, with members of the public. So as chief health strategists, public health departments are required by state statute to conduct a community health assessment that drives a 5-year community health improvement plan. So we are in the middle of our 5-year plan, and I don't think it's any surprise to anyone here in this room that access to health care was a top priority identified in our community health assessment that's now driving our plan. Another top priority is behavioral health. I don't know about any of you, but I've observed over the last few years that life is tough, and many of us are grappling with our own mental health and substance use challenges, and so we really wanted to be sure that we prioritized behavioral health. Also related to our youth, right? We have to be good stewards and set them up for success now so that they can be strong and resilient adults. And so we're doing a lot in the behavioral health space as well. And then a third priority in our plan is environmental health. Many of us live here because we enjoy the natural amenities of Chaffee County, and it's really important that we invest in our air quality, water, natural landscapes, hazardous materials, and so environmental health is also a top priority. So I had the great fortune of being thought partners with Lydia and Barb and Carol, kind of at the same time. I don't think they planned it this way, but maybe they did. Around the same time in winter of last year, they each came to me and said, what are we doing about access to healthcare in this county? Countless stories, both mainly anecdotal, of friends and family members who are having a tough time accessing the care that they need here. Maybe it's the cost of care, maybe it's the time to get an appointment. And at that moment in time, it really just made sense to take a deep dive into these conversations that were popping up around our county. I believe at one point there was some pressure to have some community forums. And I thought to myself, you know, many times people come to these community forums and they have a lot to say. The people that tend to not come to the forums are the people who perhaps have had a pleasant experience with our healthcare system. And so we thought, you know, there's probably a more constructive way for us to gather data around access to healthcare and to have it in a solid, you know, quantifiable report. So last winter we worked on this. We had many conversations and meetings. We really wanted to be as thoughtful and as inclusive as possible in launching this. When I did bring the subject up to my amazing team, I kind of maybe got some cross eyes, and we just knew at the time that it was the right thing to do. So with the help of some of our friends here, we created the survey. We launched it in May of last year. It ran through July of last summer, and we got one of the most overwhelming responses that we ever have to any of our surveys in the time that I've been here. So kudos to all of you who took the time to take the survey. It's not a one and done. This is just one tool to help leverage the amazing work that takes place here in the county. We're good. We know we can be excellent. And so with a little bit of elbow grease and a lot of conversations, progress is already underway to address the top needs in this report. So we were going to have it up on the screen, and we didn't want to strain anyone's eyes or any necks. So we're just going to review what's in the summary report. I am happy to send it out far and wide. So if it makes sense to send through an email distribution, I'm happy to do that. In the spirit of transparency, we really want everyone in the community to have access to this information.
Andrea, can we get a copy of your PowerPoint and we can put it on our website?
You sure can. So a little secret is that the PowerPoint is just this report on a PDF. Awesome. So a little bit about the demographics on who took the survey. It was largely female, and we did have an overwhelming response from our 50-plus community. And that is indicative of the demographics here in our county as well. So there really weren't any surprises there. We had almost 1,300 people take the survey. At one point, we had 1,444, and we quickly discovered the power of bots. So do you know that there's actually companies out there that find surveys and erroneously fill them out or take them to mess up your data? And so, when we started seeing a large number of IP addresses from California, we started to kind of question who is taking this. So we spent a lot of time having to data mine to take out all the bot, the generic, the fake answers so that we could get real data. Mainly English-speaking folks took it, although we did have the survey in Spanish, and we worked with our Latinx community to try to push it out as much as we can. We are acutely aware that in this day and age, our Spanish-speaking population is very wary about filling out information and surveys. And so we've been kind of brainstorming as a team to figure out, okay, how can we couple this data with some meaningful conversations with our Spanish-speaking community? So again, we're not going to give up here. We know we still have a lot of work to do. So anyways, a fairly broad range, we sometimes wonder, how many people are engaged on the north end of the county versus the south end of the county. So about half of the respondents were from Salida and 25% were from BV. So that's pretty close to our demographics that we see on a regular basis. All right.
What about the other 25%?
Oh, from Poncha, unincorporated. Yeah. Totally, yes. And anywhere around the county. And I'm sure we did have a few people. I know Barb was hitting the FIBARC scene really hard, hitting the pavement during FIBARC. So it is possible that maybe someone who's not necessarily a local just took it for fun. But we were able to identify that the majority of people were from Chaffee County. And so barriers and affordability. I think that's really important. We've had some great discussions with the HRMC Board of Directors on maybe defining better what we mean by barriers and affordability. We've had some great conversations about what is healthcare in general. We didn't really define it. We also quickly discovered how many types of healthcare are in our community and really wanted to make sure that people understood that when they were taking it, they were filling out the right definition that we were using. So I think in the future we will use better definitions and define what we're talking about and give examples. But the biggest barriers to healthcare in Chaffee County: getting an appointment takes too long. Has anyone had that experience before here in the county? About half of respondents said that they have experienced that as a barrier. Another barrier: I can't find the type of healthcare provider I need. Has anyone left the county to receive healthcare in the last few months? I have. And so while we know our healthcare system is a robust one for our rural geography and for the resources that we do have here in this county, we do know that people do need to leave the county to receive healthcare. My question to folks is, are you leaving the county to receive health care because you can put your kids through the dentist on the Front Range, but then also hit up Costco and a shopping mall, maybe drive some cars, test drive? That is not uncommon for my team to spend the day on the Front Range to get health care and to do other things. But we really wanted to know, to get to the root of why are you leaving? I don't think the quality of care is good enough. That was 30%. So that, to me, that struck a chord. I'm like, what is that all about? I want to know more. And then the cost is too high. And so that also is pretty close to quality of care. So again, getting an appointment, the type of healthcare provider, the quality of care, and the cost are the four main barriers. However, I do want to point out that 17.9% of people said there are no barriers. I think that's really important. We as a society like to lean toward the negative or what's wrong with the system. I really do think we have to point out what is right with the system, too.
Is there a demographic, or was there an age group that responded to that 17%?
No. Nope. Okay, so then we also wanted to point out of who is taking the survey, what insurances do they have? And so, again, this is in line with the age demographic, but about half of them reported that they were on a Medicare or a Medicare Advantage plan. We have about 40% that have private insurance or employer-owned insurance, and then a small section that receive it from the marketplace, the Connect for Health Colorado Exchange. We also oversee that program at Public Health, and so I don't know if you've ever met our amazing health coverage guide, Michelle Ney, but she helps people who don't qualify for Medicaid to get hooked up to a private insurance on the health exchange. And she's able to secure those plans so that they are pretty competitive and affordable for our county. And providers take them as well. So a couple other questions that I got asked were, what about people who have no insurance? We didn't ask that question. So again, these are all lessons learned that we're going to take for the next time we conduct our survey, which probably won't be for a couple of years or so. But we do want to replicate this. We heard that loud and clear that in order to make this as a useful tool, we need to know if we're doing better over time or worse over time. Same thing with Medicaid. We know that those numbers fluctuate from time to time, but we have a good portion of people who receive Medicaid benefits in our community as well. So we just want to make sure that we collect that information. So then perceived, can you afford your health care? 62.9 said, yes, I can afford it. Again, that is subjective. What is affordability? Did you decide to buy a vehicle or pay off your house versus pay for your medical bill? These are all decisions that we have to make on a regular basis. But 8.8% flat out said no, that they can't afford their health care. So that's 8.8% too many as far as I'm concerned. So we need to really look and see how we can offer more healthcare affordable options to those individuals.
Was that distributed across age groups?
Yeah, it was. The question was it distributed among age groups? And it was. And then, have you ever considered moving to another city, state to better meet your health needs? This is something that we hear quite frequently, that folks just can't afford to live here, they can't afford their health care here, and over a quarter said yes, that they have considered moving to another place to receive their health care. That's not a small number. So I really do think that we need to be kind of coming together, thinking about maybe some solutions around that. Carlo.
Yeah, just my experience with working with realtors, a lot of people come from a lower altitude in their retirement age, and then after they live here for a while, they realize they can't live in a high altitude, and they sell and they go back.
Altitude is a huge issue here, for sure. That's a great point, Carlo. And so we didn't ask that question, but we did collect a lot of qualitative data. We're not including the qualitative data in the summary report because it would be 100 pages. People were not shy to give us their unsolicited feedback, both pro and con of our healthcare system. And just so you all know, we have shared that raw data with the executive leadership teams at both Solvista Health as our community mental health provider and with HRMC. And then, were your health needs met? So you can see here, we asked a whole bunch of subsections of our healthcare system, asking folks, are your healthcare needs met in these areas? Now, I think that some of the answers definitely pointed to we need to do a lot more on just health literacy and financial health literacy, because some of the comments that were made about public health was like, oh gosh, we've never provided that service before. So again, maybe that's when the definitions would have come in a little bit handy. I don't mean to brag, but public health was doing really well, at least perceived really well in our community. So I thought that was a positive sign and motivation for us to do even a better job at public health. Also ranked highly are pharmacies. And again, that we have a wide range of pharmacies. We have, the outpatient HRMC pharmacy. We have City Market. We have, Buena Vista Drug. And so that is a wide range. But overall, our pharmacies seem to be perceived as meeting healthcare needs in our community. I think it's really cool, too. Like Lucas in his model, it's not just prescriptions. There's a lot of other services that you can get when you do go to our local pharmacies. And I think that model is brilliant because it kind of makes it to be a one-stop shop for your healthcare needs, that you don't have to go from one place to the next place to get each need met. Holistic health appointments, also high. We do have a large array of holistic health providers in our county, probably more so than other counties our size. So they were rated really high. Same thing with the vision. I was really surprised to see that because we don't have a ton of places where you can get glasses or contacts, but also ranked very high. And then inpatient stay, dental appointments, mental health was somewhere in the middle. And then outpatient visits, primary care, hearing, substance use services, and emergency room visits. And Lydia, Barb, and Carol will remember one particular meeting in which we spent an hour and a half figuring out which services go in which bucket and what to call them, because how do you limit the size of this survey of trying to get a robust set of information? And so I think we have some lessons learned about that. Now, I think this is where we really do need to put some focus on. Overall, mental health was 4 out of 5. Financial health literacy was 4 out of 5. And overall physical health, again, that's perceived, it was 4 out of 5. So I just feel like we tend to take great pride as a county to be healthy and well and come to Chaffee County and enjoy the fresh air. And that's great for some, but not everyone. And so we really need to focus on those areas to ensure that everyone has everything they need to thrive in health and wellness here in this county. 76% of respondents said that they're satisfied with their physical health, and 80% of respondents are satisfied with their mental health. Okay, and how am I doing for time? Because I could just talk to y'all all afternoon. It's so nice to see so many familiar faces, and I just really appreciate what the league does here in this county. All right, so what are we excelling in our county? Well, we are excelling in access to operations and services at our local hospital, access to primary care and doctors and providers, availability of urgent and clinic care, another mention of public health, specialists and specialty care, and physical therapy. And I just like some of the quotes that we did include in the report. I'm glad we have a local hospital and can do many tests there without having to go out of the county. My primary care physician is very responsive via the portal. and clinics are well connected with quick availability of lab work and most scans and procedures. Okay, so the challenges, because we know that there are many. And the funny thing is that the things that we're excelling in are also the things that we are challenged in. It makes interpreting the data a little tricky. However, again, the challenges are affordability and cost, appointment scheduling wait times, dental, and insurance coverage. Now, I don't know if you all know, but we at Public Health have an oral health program. Very few local public health agencies have an oral health program. We're one of maybe 8 in the state. And that allows us to try to attract and retain dental providers that will take Medicaid and that will take kids on Medicaid. It's really tough to get those folks here and to get them to stay here due to reimbursement challenges and so forth. So we take this data and we take the programming we do offer and help inform it so that we can bring more providers here. Certainly, HRMC would be doing the same thing. And then just some quotes. I wish it was easier to get doctor appointments here and that there were some more specialized care doctors. Cost of care in Chaffee County is outrageous, particularly for emergency rooms visits and any testing. We should not have to leave the county for these types of things when other small rural areas are not charging the exorbitant amounts that Chaffee County has. So all across the board, we heard feedback, and I think in the months to come, progress is underway. I'm meeting with the HRMC CEO and VPs and board members, Lydia, on a regular basis just to say, hey, we're not here to point fingers. We just want to be excellent. Like, how can we be excellent? We at Public Health have also created over the last couple of years a health navigation workforce. So we have health navigators in oral health, housing, behavioral health, general health, and they all meet every other week to talk about resources that are in our community, what resources are missing, how we can pool together our resources to bring more opportunities here in the county. We're about to do some case consultation too. I don't know about you, but it doesn't feel good when I go to my primary care provider, but my other provider hasn't even talked to my primary care provider about what I just went to for whatever service. We need to be more coordinated and collaborative. And so we'll be doing more case consultation here on the horizon. We are also, through our leadership roundtable, we've established a safety net work group. So resources do appear to be evaporating before our very eyes, especially in the public health field and in healthcare. And so we're trying to get ahead of that here in our county. So we've been meeting several times already to talk about how we can leverage our community foundation, how we can leverage Chaffee Resources, which I left some material on your tables. Chaffee Resources is your one-stop hub for all things health and wellness here in the county. It is a website that we're building out as we speak to make it more user-friendly. The idea is that I may be a nonprofit in the community facing a budget cut, and I provide what I'm deeming a safety net service in our community. If I don't do it, nobody else will. Well, we don't want that nonprofit to close its doors, so we're looking at how we can pool resources so that in the future, if there are cuts or funding glitches, that we do have extra money here to cover those costs. The foundation has been wonderful. They, on the horizon here any day now, we're going to start a Friends of Public Health Fund. That's something that we've been talking about for a while, and with just the funding cuts to Health and Human Services, the NIH, the CDC, and CDPHE, which is the Colorado Department of Public Health and Environment, where I get the majority of our local funding, we have to game change here, and we have to figure out how we continue to provide the services that we do in our community with evaporated funding. So no easy feat, but people do ask, hey, how can we support you? I participate in your free yoga for older adults. I participate, I get my flu shot from you every year. This is one way that our community can help feed into our public health system so that we're resilient and sustainable moving forward. So lots of action going on when it comes to addressing the survey and the survey results. We just continue as leaders in our community to prioritize health and wellness. And please don't be a stranger. I know I see many of you at meetings and community events, and let's have coffee. If you have an idea that you want to pitch and it seems to be meeting a need in our community and maybe there's a funding stream attached to it, wink, wink, let's talk about it. Let's see how we can address some of those issues. Because I think we all have sacrificed a lot to live here in the mountains, and we take great pride in our health and wellness, and I think we'll be able to weather any storm as Chaffee County. I'm happy to answer any questions. Or Lydia, Barb, Carol, was there anything like burning that you were like, oh, Andrew's going to say this, she's going to say it, oh, she didn't say it? I'm really proud of the survey. Yes.
How's our county doing in terms of gerontology?
Gerontology?
Yes.
Yeah, so the hospital actually did just hire a gerontologist. Lydia's nodding her head. I can have her chime in here.
Hi. So after 2 years, got that. So after 2 years, we finally got Dr. Erica up here, and she's been here since February 1st. So far, I think everyone who's seen her has loved her. And so she's a board-certified geriatrician who, not a gerontologist, I was corrected, geriatrician, who has 14 years of experience. She's board-certified. And I would suggest that if you have complex medical problems, which no one in this room has, not one of us, takes no medication, only sees one doctor a year, then don't go to see her. And she's still taking new patients. And the wellness center down at the hospital does several programs for different levels of fitness for people over a certain age. I know that because my husband goes 3 days a week. Does that answer your question, sir, or was there a different question that I'm actually not answering at all?
Thank you.
Okay, you're welcome.
For both of you,
Is there another one about? Oh, this is Andrea.
We're sharing, Lydia.
Okay, well, thank God you can have it back.
public health have a fluent in Spanish person on staff?
Okay.
And also for the hospital.
Can you all hear me? We have a translator program.
Lydia, stop. We're recording this, so please speak into the mic.
Thank you. We have a translator program, so many of our providers don't speak a second language, but there is a program that's available to them, as well as translating every document and every important document that's on the web page. Last time I checked a few weeks ago, because somebody asked me this question, it has a translated version into Spanish. Does that help answer your question?
Yes, but I wish there was someone that was fluent in Spanish.
This has been a dream of mine because for the time I've been in our department, we've really struggled with hiring anyone that can speak fluent Spanish. And that's a huge disservice to our community. And so our administrative professional, Nadine, we got her from Lake County Public Health. I worked with her in the past. She is fluent in speaking and in writing, and that has really helped us be able to connect to those members of our community that do speak Spanish, as well as to update all of our forms. And then due to the ADA requirements, websites are now required to have that translation button. And so the counties just went through that process. And so we now have everything translated into Spanish. Yes.
This goes sort of with what you talked about. I was a school nurse in Denver and in a Spanish-speaking community, and thank goodness my secretary was fluent because I was not. But I had a large population of illegal Spanish speakers, and the hardest part is getting them into the door. they won't, it's like this door has a.
It's really important to foster trust and those relationships.
What happened is I had what was called, that's why I was suggesting, they had a community advocate who was a Spanish-speaking male who helped me, and then we were able to get them through the door, and they got flu shots, and sometimes they drug their kid in, and I took a temperature and so forth and so on. But it may be something you might want to look at some of those schools that have higher population.
Most definitely. We do work very closely with our school nurses. Thank you for everything that you did for those kids.
No, I just thought it was a big help to have this advocate.
Yes.
And also mine. And then the other thing I was looking at when you were talking about money for the department with all the other infusions. And I wondered if you're not on VV Gives, right?
Okay.
Because I think a lot of people go through that and just see what's available, and you may get some donations that way.
So the question is about getting on BV Gives, and it's all in the works happening. Because we're government, we have to be really careful about what we can take and what we can't take. But I think we're getting really, we're becoming more expert than we've ever had before on how to jump through all the hoops so that we can actually get the funding. That's great. Carlo.
Yeah, so I work with Hispanic people, and most of the ones I work with now have smartphones, and they talk to them in Spanish, and it translates to English. So, you know, it's getting a lot easier with this high-tech stuff.
Thank you. All right. Yes, another question.
I'm always curious about Valley-wide.
Okay.
How does that, do you work with them?
We sure do.
Because you didn't mention them when you mentioned all the other ones.
Yeah, so Valley-wide Health Systems is our federally qualified health center. They opened their doors during COVID. Very unfortunate time, I think, for them, and they've been really trying to build up their identity here in town and make those connections. We have conversations with them on a regular basis. They attend our Chaffee County Health Coalition whenever possible. We fold them into the events that we're doing. And so I think, you know, in healthcare, particularly rural healthcare, what really does cripple us is turnover. We have a lot of turnover in these vital sectors in our community. So just as like staff are starting to get to know the community and making those connections, then we see turnover. But yes, Valley-wide is a great partner with us too. Mm-hmm. Any other questions or comments?
What does that mean, federally funded healthcare?
Federally qualified health center is just that they get special funding to be able to provide the services they do in our communities. They are the safety net provider in a lot of communities and tend to accept a large number of Medicaid clients that have Medicaid insurance. Great question. I think there was another one.
That was another thing, because my ears may have not heard you. With Medicaid and glasses, is there anybody in the county that takes Medicaid to do eyeglasses?
I can look into that.
Well, because that was a concern I had with a friend, and I never found a place.
Never found a place. Okay. Yeah, I'll do some research. I wouldn't be surprised if it's a gap, for sure. Okay. We think Ascent might. Down on the south end of the county. Well, it has been a pleasure. Oh, we have another question.
Excuse me. Why do you think public service is getting a bad rap in our county?
The question is, public service getting a bad rap in this county? Give me an example, if you don't mind.
I use public health. I get my vaccines there. I think you guys are wonderful. And
Thank you.
so I don't understand why people would complain about the services that
I could answer that question.
Uh-oh.
So there's a lot of people around, especially Denver, that migrated in the 70s and 80s from other communities, and the health system back then wasn't that good, and they would have bad stuff. And then when new people would come, the old timers that have been here for a long time, tell people, oh, don't go to the hospital, especially when the old hospital was there. But things have improved a lot. But You know, there's a lot of people that move here, and they want the same thing that they came from, and that's just not going to happen. So if you want to move here, you got to accept what the living situation and the services are.
Thanks, Carlo. You know, I think to end, if we're talking about public health and the landscape that we're working in, what I will say is that public health has become politicized. It has become scrutinized. We provide potentially controversial services and supports in our community. And I wouldn't want to do what I do, especially during the pandemic, anywhere else besides Chaffee County. This is an amazing community. I mean, we work here, we live here, we give here, we sacrifice for here. And so while a lot of my peers, especially over the last 5 years, have retired early, they have resigned, pursued other careers, many of them were fired, half of them were fired during the pandemic for doing their jobs. And that was heartbreaking for me to see my peers, who I know were dedicating a lot of their time and passion to protect their community. They, were fired for that or threatened for that. And so I think in reflecting the last few years, I think if you put your heart and soul into what you do, and you're just your genuine, authentic self and actually care for the people around you, I think that speaks volumes in our county. I know that not every county has had that same experience. Just over the last few weeks, the state health department had to let go a lot of the people that we were working with closely at the state lab and our epidemiology team at the state, while we're starting to see the first cases of measles hit our state. And so as of this morning, we still had 3 cases here in the state, all unrelated to involving travel to a high outbreak community. One is assumed to be community spread. And you may have heard that term during the pandemic, is when we can't pinpoint where the virus came from, then we can assume that there's community spread. And so we're in a very vulnerable time in public health, and I think we'll just continue to fight for our community and do what we can with the limited resources that we do have. I have an amazing team, and last week was National Public Health Week, and we got to celebrate them, and the commissioners wrote a proclamation that they read out loud. Lots of just heart for our public health servant. So we're going to continue to do what we can to preserve our strong reputation and protect our community. Thank you, everyone.
They do all of the newborn tests, the little needle stick and all of that. And if they have cut their staff by half, it's going to have a very large impact on the ability for us to get information that's given to the lab and disseminated back into the community. I think people here need to know a little bit more about
I'm happy to share my perspective. So the way that I've framed this up mentally is when our country is unplugging from the World Health Organization, at the same time that it's defunding and de-resourcing the Centers for Disease Control and Prevention, the National Institute on Health, and the Health and Human Services branch, we're in for a wild ride. And so to Carol's point, we've really relied on these science-based data collecting cohorts and institutions in our country. I think that's why we've fared really well in our morbidity and mortality rates. And so we are watching these trends and seeing the websites that I used to be able to go to for chronic disease data are shut down. The page that I used to go to find out demographics is no longer in existence. A lot of my peers lost a significant amount of funding recently because they had diversity, equity, and inclusion written into their contracts. This was something that at one point here in the recent past was the attribute of public health is to working on behalf of the health equity of our people. And that has been defunded. And so now we have to get creative of what we want to call it, or we have to just pass on federal money. So it is a dire time. And we're watching this, and we're attending a lot of meetings, both at the federal level and state level, and trying to posture ourselves here in our state so that these rapidly changing dynamics don't impact our lives and livelihood. But it's kind of the trifecta. What I'm seeing now is, I know we're talking a lot about the money, and that's really important, but I'm also seeing lives and livelihoods being taken away. And that's what breaks my heart, because you don't get into this work for a big paycheck. You do it because you really care. And so a lot of my peers are losing their jobs. They are being silenced, and it is concerning if you work in the public health space. So I guess then, to Carol's point, if you don't know what's going on, sometimes I can be a big fan. I can get behind ignorance is bliss. However, please reach out if you are curious, if you have questions about what's happening. I'm happy to have, again, from my perspective, limited perspective of what I'm seeing and hearing happen in the public health sector and healthcare. Happy to share that with all of you. Thank you.
Thank you so much. Here, I can talk, huh? Thank you so much, Andrea. I'd like to appreciate you coming today and all the work that you're doing. And we do really appreciate it. We know it's hard. We probably don't know how hard it is, but we do know that it's hard, and we appreciate you doing that. So, and sharing this.